Imagine this scenario. It is, let's say it's 2 in the morning.
Oh, the classic 2 a.m. spiral.
Literally the worst time. You are lying in bed, you're trying to sleep, when you feel this sudden, sharp little cramp in your side.
Just a tiny twinge.
Right, just a twinge. And for most people, that is just a minor annoyance. You might think, I probably shouldn't have eaten that late, and you just roll over and go to sleep.
Yeah, you just brush it off.
Exactly. But for some people, that tiny physical sensation is the start of a total mental hijacking. I mean, within 10 seconds, your brain has completely bypassed indigestion and, diagnosed you with liver failure.
It jumps straight to the absolute worst case scenario.
Straight to it. And within 10 minutes, you are spiraling down an internet rabbit hole, reading medical forums in the dark.
Yeah.
Your heart is pounding, and you are entirely convinced that your life is about to change forever.
And that is such a terrifying place to be.
It really is. So today, our mission is to unpack the clinical reality of what happens when that agonizing cycle basically becomes your everyday life. We are talking about a condition known as illness anxiety disorder.
Which is so widely misunderstood.
It is. And then, because we don't want to just leave you with the problem, we're going to explore how modern therapy is actually solving this. Specifically, we'll be looking at this really accessible, real-world telehealth model out of Georgia called Coping and Healing Counseling, or CHC. So, okay, let's unpack this.
What's fascinating here is the sheer gulf between standard everyday worry and the truly debilitating condition we are exploring today. I mean, evolutionarily speaking, we are all wired to be a little bit vigilant about our health.
Sure, it's a survival instinct.
Right. If you get a weird, persistent cough, thinking, I hope that's not serious, that's just normal human self-preservation, it literally keeps us alive.
Yeah, you'd be reckless not to care at all.
Exactly.
Yeah.
But what we are talking about today takes us far, far beyond a fleeting protective worry. We are looking at a self-sustaining loop of clinical anxiety. And it completely alters a person's reality. It fundamentally changes how they interact with their own body, their loved ones, and honestly, the entire medical system.
And I think to even begin to understand how this condition traps people or, how to get them out of it, we really have to establish what this condition actually is.
Let's define what it isn't.
Yes, exactly.
Right.
Because for decades, society and honestly, even the medical community used a very specific word for this. They called it being a hypochondriac.
Which is such a loaded term.
Extremely loaded. But today, the clinical term is illness anxiety disorder, or IAD. And I think we need to talk about why that rebrand was so necessary. Because, hypochondriac isn't a medical diagnosis anymore. It's a punchline.
It really is.
We use it as this casual insult for someone who we think is just being dramatic or, attention-seeking.
Exactly. And using hypochondriac as a pejorative completely dismisses the immense, very real psychological pain that the patient is experiencing. I mean, illness anxiety disorder is not a character flaw.
Right.
And it is certainly not a grab for attention. It is a highly distressing condition. By clinical definition, IAD involves a severe, consuming preoccupation with having or acquiring a serious illness.
Okay, so it's that constant obsession.
Yes. And here is the crucial diagnostic pivot. This preoccupation exists despite the absence of significant physical or what clinicians call somatic symptoms.
Wait, really? No physical symptoms at all?
Right, or they are incredibly mild. The patient is absolutely consumed by health-related anxiety regardless. And for it to be officially diagnosed as IAD, this relentless pattern has to persist for 6 or more months.
Wait, I want to clarify something here because it seems like there is a really fine line. There's a sharp distinction made between illness anxiety disorder and another condition called somatic symptom disorder.
Yes, a very important distinction.
With somatic symptom disorder, if I understand it right, there is a very real, potentially severe physical symptom that is causing the distress.
Correct.
But with IAD, the physical symptom is either non-existent or completely mild, like a normal stomach rumble or a slight headache or random muscle twitch.
Just everyday bodily noises, basically.
Right. It's like having a highly sensitive smoke alarm in your house that goes off constantly, emitting this piercing, terrifying shriek, even when there's absolutely no smoke, no fire, no danger.
I love that analogy.
You are living in a constant, exhausting state of emergency response to a totally safe environment. But how is this definitively different from someone who just has an unexplained physical symptom that they're, rightly worried about?
Well, that's the tricky part.
Because we've all heard stories of people who had, say, a rare autoimmune disease that went undiagnosed for years, while doctors just told them they were fine.
Yeah, and that is the critical distinction clinicians have to make, and it's why diagnosis requires a skilled professional. With an unexplained physical illness, the patient's anxiety is generally proportionate to the unknown physical reality they are experiencing.
Okay.
Their body is genuinely failing in some way, and the anxiety is a secondary reaction to that mystery. But in illness anxiety disorder, the core issue is not the physical body failing. The core issue is a profound cognitive distortion.
So the brain is basically tricking them.
Exactly. It is the fear of an illness that is the disease itself. The engine driving the distress is composed of anxious cognitions, intrusive, terrifying thoughts about health that the person genuinely cannot turn off.
Even if you show them the medical tests.
It doesn't matter how much logical evidence is presented to them. Their brain is processing a perceived threat as an absolute catastrophic certainty. It is a disorder of the mind's threat detection system, not the body's physical organs.
Which perfectly explains why trying to logic your way out of it at 2 in the morning never works. The alarm is broken.
The alarm is completely broken.
And that brings us to how this actually plays out in a person's day-to-day life. Because once that internal smoke alarm starts blaring, you can't just sit there. You feel like you have to do something about
You're
it.
compelled to act, yeah.
Right. So to cope with this deafening anxiety, patients tend to fall into 2 extreme behavioral camps. There's the checking extreme and the avoidance extreme. Let's talk about the checkers first, because this isn't just Googling a symptom once and moving on. This sounds exhausting.
It is entirely exhausting. I mean, the checking behavior manifests as a relentless compulsion. The individual might spend hours every single week falling down internet rabbit holes.
Oh, I've been there. WebMD is a scary place.
It is. And they're reading medical journals. They don't have the training to interpret, researching every possible manifestation of some rare disease. They schedule repeated just-in-case doctor appointments, demanding scans and blood work.
Just constantly seeking proof that they're okay.
Exactly. And on a micro level, they are constantly checking their own body. They might monitor their pulse 100 times a day. Or they might repeatedly press on a lymph node in their neck to see if it feels swollen.
Which probably makes it hurt.
That's the irony. Pressing on it causes the tissue to swell and hurt, providing them with the exact proof they were terrified of finding in the first place.
Wow, so they are actually creating the physical symptom by checking. That is wild.
It's a vicious cycle.
And then you have the complete opposite end of the spectrum, the avoidance extreme. These are people who are so paralyzed by the fear of receiving bad news that they refuse to step foot in a doctor's office.
Right. They just completely shut down.
They avoid medical care entirely. They might have a genuine mundane issue that needs attention, like needing a routine dental cleaning or a basic physical for work, but the sheer paralyzing terror of what a professional might find keeps them away.
The fear is just too overwhelming.
So you have one person practically living at the clinic and another who would rather do anything than go. But fundamentally, both extremes are just different strategies to manage the exact same underlying terror.
Precisely. And what's vital to understand about the checking behavior, especially the compulsive self-diagnosis through internet searches, is that it is not a harmless quirk or a quirky personality trait.
Right. It's not just someone being overly cautious.
No, this frantic searching is actually part of the very pathology of the disorder that requires treatment. It is a leading driver of avoidable healthcare utilization. The medical system sees an enormous burden from IED in the form of repeated visits, redundant workups, and endless specialist referrals.
Taking up resources.
And none of it actually solves the patient's core problem.
Here's where it gets really interesting. Let's put ourselves in the shoes of someone who is terrified they are sick. You would assume that getting a clean bill of health from a doctor would be the ultimate cure for that fear.
That is the logical assumption, yes.
Yeah. Right. You go in, you get the MRI, the doctor sits you down and says, "Great news, your brain is totally fine, there's no tumor." Logically, that should be the end of the anxiety.
You would think so.
The fire department came, they said there's no fire, we can turn off the smoke alarm. But the clinical reality is that reassurance actually maintains the anxiety in patients with IAD.
Yeah.
How does that work? How on earth can hearing you are perfectly healthy actually make the psychological disease worse?
It is a brilliant, counterintuitive, and tragic psychological trap. Reassurance seeking, whether it's asking a doctor for a scan or repeatedly asking a spouse, like, does my skin look yellow to you?
Oh, wow.
Or even just asking a search engine for symptom matches. All of that is what psychologists call a safety-seeking behavior.
The safety-seeking behavior, okay.
Yeah. In the exact moment the doctor says your MRI is clear, the patient experiences a massive rushing drop in anxiety. It is a physiological relief. Their heart rate drops, the sweating stops.
So they do feel better initially.
They do, But that relief is completely temporary because the underlying cognitive distortion, that broken threat detection system we talked about, hasn't been fixed at all.
Oh, I see.
So a few days, or honestly even just a few hours later, a new thought creeps in. Like, what if the MRI machine was calibrated wrong? Or what if the radiologist was tired and missed a shadow?
Oh, wow. So the relief from the doctor is basically just a quick fix. It becomes addictive.
Exactly. It operates exactly like an addiction loop. The patient learns on a subconscious level that the only way to temporarily silence the unbearable anxiety is to get external reassurance.
They need their fix.
Right. But just like a substance, the half-life of that reassurance gets shorter and shorter over time. They build a tolerance to it, so they cycle endlessly between doctors and the internet, desperately seeking the next hit of relief.
That is awful.
It is. And every time they seek reassurance, they are accidentally teaching their brain that the only reason they are safe is because they checked. It reinforces the delusion that the checking behavior is literally a matter of life and death.
That is incredibly illuminating.
Sure.
And it totally shatters how we usually think about comforting someone. I mean, if a friend says, I think I'm sick, your instinct is to say, no, you're fine, you look great.
Of course it is.
But for someone with IED, you are just feeding the loop. And it totally reframes how the medical community needs to approach treating this. Because if running endless diagnostic tests and saying you're fine doesn't cure the anxiety, the standard medical playbook is basically useless here.
It can actually do more harm than good.
Exactly. We have to pivot to what actually works. And that starts with the primary care providers, the PCPs, who are almost always the first line of defense for these patients.
And the guidance for PCPs here is a massive paradigm shift because they are often caught in a very difficult position.
I can imagine.
The instinct of a well-meaning doctor is to look at the pristine blood test results and say, good news, there's absolutely nothing wrong with you.
Which is exactly what the patient wants to hear, but also the worst thing for them.
Right. Clinicians are actually trained not to use that phrasing with IED patients. Patients with illness anxiety disorder respond very poorly to having their concerns dismissed in that way because to the patient, there is something profoundly wrong.
They feel terrible.
They are not faking it. They are suffering immensely.
Right. If you tell someone who is actively in a state of sheer terror that nothing is wrong, you are basically telling them they are crazy or that you just don't believe them, which instantly destroys the doctor-patient trust.
Completely destroys it.
So how does a doctor navigate that without lying? They have to validate the patient's very real suffering while simultaneously initiating a mental health referral. The doctor has to help the patient understand that while their physical body is safe, the anxiety itself is a severe medical condition that requires aggressive treatment.
Beautifully put.
And importantly, that diagnosis needs to be made by a licensed clinician through a proper clinical interview and history taking, not by the patient matching a list of symptoms on some web forum.
And once that proper diagnosis is made and the patient is successfully referred to psychological care, the good news is that we have highly effective evidence-based treatments.
Okay, so there is hope.
Tons of hope. The absolute gold standard is cognitive behavioral therapy, or CBT, that has been specifically adapted for health anxiety. Alongside that, mindfulness-based approaches are heavily utilized.
Okay, CBT and mindfulness.
Yeah, and in some more severe cases, SSRI's selective serotonin reuptake inhibitors, which is a common type of antidepressant, can be prescribed to help lower the patient's overall baseline of physiological arousal.
Oh, so it just turns the volume down on the physical panic.
Exactly, making the therapy easier to engage with.
Let's break down the therapy part, because I really want to know what this actually looks like for the patient. We mentioned CBT targets those exact safety-seeking behaviors, the checking and the reassurance seeking. But how do you actually untrain a brain from doing that?
Well, in CBT, the therapist works with the patient to systematically dismantle that addiction loop of reassurance. They help the patient identify their catastrophic thoughts and logically challenge them. But the heavy lifting happens behaviorally.
Behaviorally, like making them do things.
Yes, through what's called exposure and response prevention, or ERP. The patient slowly learns to sit with the discomfort of not checking.
Oh, wow.
So, for example, the patient feels a strange muscle twitch. Their immediate urge is to pull out their phone and Google it. The therapist trains them to acknowledge the urge, put the phone down, and just sit with the spiking anxiety.
Just sit there with it.
Just sit with it. They practice writing out that terrifying wave without giving into the compulsion to check.
That sounds terrifying for the patient. I mean, incredibly hard work. But the goal, I assume, is that over time, the brain learns that the anxiety will peak and then naturally subside on its own, without needing the external fix of a doctor's reassurance or a WebMD article.
Precisely. It is literally retraining the brain's alarm system. And then there's the mindfulness component, which is used to help patients relate entirely differently to their bodily sensations.
Oh, so?
Well, a healthy body makes noises. It twitches, it aches, digestion causes rumbles. Mindfulness teaches the patient to experience a physical feeling without immediately attaching a catastrophic narrative to it.
So what does this all mean? It sounds to me like the medical field needs to stop running endless, expensive diagnostic tests on the hardware, the physical body, and start helping the patient patch their software, the cognitive processes, and the anxiety.
If we connect this to the bigger picture, that hardware-software analogy is perfectly apt. Mindfulness creates a crucial cognitive distance within that software.
Cognitive distance.
Yeah. Normally, for someone with IAD, feeling a stomach pang and thinking I have stomach cancer happens so fast it feels like one single inseparable event.
Right.
Mindfulness trains the brain to insert a pause. It allows the patient to observe the physical sensation purely as raw data. Like, I am noticing a tightening sensation in my stomach. Full stop. No narrative. No catastrophic jump to cancer.
It's just observing it.
Exactly. That tiny space between sensation and interpretation is where recovery happens. It is a fundamental reprogramming of how the brain interprets the body.
Which is an amazing transition to how this works in the real world.
Yeah.
Because knowing how to treat this clinically is only half the battle. If you are listening to this right now and recognizing these patterns in yourself or someone you love, you need to know how to actually access this kind of care.
Which is often the hardest part.
Totally. It's one thing to say, go get CBT for health anxiety, but finding a specialist can be incredibly daunting.
Yeah.
But there are specific providers applying these exact health anxiety-informed treatments right now. Let's look at the Coping and Healing Counseling Model, or CHC.
CHC is a highly relevant case study for everything we've just discussed, primarily because they have built a service model entirely designed around removing the barriers to this specific kind of care.
Okay, tell me more.
They are a telehealth therapy practice based in Georgia, and they serve all 159 counties in the state. The entire practice is a 100% telehealth model conducted over a highly secure, IPAY-compliant platform, meaning medical data security and privacy are foundational.
Wait, let's stop and think about this in the context of the avoidance patient we talked about earlier.
Right, the ones who won't go to a doctor.
Exactly. If someone is absolutely paralyzed by the terror of medical settings, like if just the smell of rubbing alcohol in a clinic or sitting in a waiting room or the fear of running into a doctor in the hallway might trigger a panic attack, asking them to drive to a therapist's office to talk about their health anxiety is almost impossible.
It's a massive barrier.
Telehealth seems like a brilliant practical workaround. Being able to log into a secure portal from their own couch, in a space where they already feel physically safe, might literally be the only way an avoidance-heavy patient ever actually starts treatment.
This raises an important question about how we fundamentally design healthcare systems. Removing geographical and psychological barriers by serving all 159 counties via telehealth is a huge step, but we have to acknowledge that financial barriers are often just as insurmountable as the psychological ones.
Oh, definitely. Therapy can be incredibly expensive.
Right. You can have the best CBT in the world, but if it costs $200 an hour out of pocket, it doesn't matter. The patient can't access it. CHC has addressed this aggressively. Their pricing model is highly accessible.
Okay, how accessible?
For Medicaid patients, there is a $0 copay.
Wow.
Yeah. They also accept a wide spectrum of commercial insurances like Aetna, Cigna, Blue Cross Blue Shield, United Healthcare, and Humana, with patient sessions ranging from just $10 to $40.
That's a game changer. By neutralizing the financial panic and the geographical hurdles, you are allowing the patient to focus entirely on the incredibly hard work of dismantling their anxiety. And they aren't just a small one-person operation trying to handle all this, right? They have a robust infrastructure.
They do. They have a team of over 15 licensed therapists. We are talking about highly trained, licensed clinical social workers, licensed professional counselors, and licensed marriage and family therapists.
A solid team.
And crucially, it is a diverse, culturally competent team. When you're dealing with deeply personal mental health care, especially regarding your physical body, you need to feel inherently understood by the person sitting across from you, even if that connection is through a screen.
Absolutely. And while they are clearly equipped to handle complex anxiety presentations like IAD, their umbrella of care is huge. They treat individuals, couples, and families. They offer teen therapy for ages 13 and up, alongside life coaching.
It's very comprehensive.
Yeah, their specialties encompass general anxiety, depression, trauma, and PTSD, grief counseling, relationship issues, and chronic stress management.
Hmm.
They're providing comprehensive mental health care, not just a niche service. And just to make sure you have actionable resources, because discussing severe anxiety without providing a way forward just isn't helpful. If you are in Georgia and want to reach out to them, their contact info is straightforward. You can call them directly at 404-832-0102.
That's 404-832-0102.
Yep. You can visit their website at sheettherapy.com, or you can email their intake team at support@sheettherapy.com.
Having that specific, actionable avenue is vital. Knowing that evidence-based treatment is not just a theoretical concept trapped in some academic journal, but a real, accessible service you can access from your living room completely changes the landscape for someone suffering from this disorder. It turns hopelessness into a practical set of steps.
It really does. So to wrap up our deep dive today, we've traveled from the harmful, outdated, and honestly insulting stereotypes of the hypochondriac to the clinical reality of illness anxiety disorder. We've seen how it is a highly distressing but entirely treatable cognitive loop.
Very treatable.
We've learned the counterintuitive truth that getting reassurance and running endless medical tests actually feeds the beast, and that the true path to freedom requires shifting away from treating the physical body and moving toward targeted mental health therapies like CBT and mindfulness.
Patching the software, as you said.
Exactly. And finally, we've seen how practices like CHC in Georgia are making these life-changing therapies incredibly accessible through affordable telehealth. The power isn't in fighting your bodily symptoms, it's in rewiring your brain's response to them.
And as we close out today's exploration, I want to leave you with one final lingering consideration regarding the modern world we all navigate.
No.
If our frantic late-night internet symptom searches are actually a diagnostic symptom of an anxiety disorder rather than a legitimate cure for our fears, at what point does our modern, endless 24/7 access to online medical information transition from being an empowering tool to becoming a self-inflicted public health hazard?
That's a great point.
How do you, navigating this digital age, balance being a well-informed advocate for your own physical body with protecting the peace of your own mind?